Any one of the patients? There you go. So as you know, the medication comes up on the MAR.
Yeah.
Everybody can see that. But you go to airway management.
Yeah.
So inside the spirometer, that way it all comes up.
Okay.
So yeah, if you double click in there, it tells you, well, the line above. There you go. So when you tap down, it'll go down, yeah. So that tells you their predicted, which will tell you what their height, their age. It'll drop down one. That will give you their actual volume they achieve. And then it gives you a percentage after that. And then you tell how many times they did it, 10 times. And then if you click on breath hold, it'll ask you yes or no. And then if how was the patient effort, good, bad, and fair. Yeah. So there's the cough. If you ever suction anyone, you can double click there. Know how to chart how they suction. So double click the line above again. Alright. Suction in.
You
So
do
you can-
respiratory treatment in here too? I
Yeah.
meant like in the same?
No. If you
Okay,
do
that
it
would be
with the
somewhere.
treatment, yeah. So you're doing suctioning by itself. So I ask you what.
Oh, let me unclick that because I.
No, we can uncheck it afterwards.
Okay.
You can actually just.
Do
X
the
out.
amount. Was it a large amount, a moderate, copious? What the color? Is it bloody? Is it clear? Is it rust? Is it tan? Inline, or if you did the tracheostomy, or endotracheal, nasal trachea, bulb syringe if you're doing a baby. Depth size, don't really have to tell that, or the fringe, but most likely you're using a 14 fringe. You'll have 18 too. Number of times, and then you said how did they tolerate it. Did you use saline? Most likely that would be on the vent. Did you notify yourself? There's pain. And then there's the charge. So if you click yes, go ahead. And then you hit charge. And that was just how that goes.
Now, do we need to always do the charge?
Every time you do it, yeah, I'll drop a
It
charge.
says RT only.
I mean,
I'm just
you still
saying.
drop a charge. But you can click that one and everything comes off. Yes. All right. So here in the respiratory section, go up top,
Oh,
double click. Oh, that just tells you. I wanted to see what that is. Okay, that's just how they're breathing. But under patient assessment is where it is. I wanted to see the pre and the post. So before you give a treatment, go to their vitals. Where's their vitals?
should be under patient care.
Oh, there it is, vitals. So when you double click in that line, so there you give a treatment. So you always want to document heart rate and respiration. So you do that would. It doesn't say pre.
But if you've clicked pre up here, the value should be pre.
Oh, okay. You saw pre up there earlier?
Yeah.
Double click again? Oh, okay.
Pre.
Okay, there it is. Oh, that's what I was looking for. So, pre-treatment, 10 minutes after, post. So usually it'll be a 10
I
minutes.
do have a question because this came up last night. So, in here where it says, you know, when we put them on BiPAP, there's
Oh.
not a choice for BiPAP.
Yes, there is. So if you go back to airway management, and, nope, non-invasive down here.
So it doesn't say BiPAP, it says non-invasive.
Non-invasive, yes.
Got it.
So double click on it, we'll show you what it looks like. Double click the line up top there. So it tells you BiPAP or CPAP,
Got
whichever
it.
one you put them on. That machine does not have CPAP, so you'll only be doing BiPAP out here. And as you can see, artificial airway, so this is where you document your airway.
Mm-hmm.
So you're gonna click that little button there.
This one.
One click. So you're gonna select endotracheal tube, the time, and the during hospital stay. If they're coming in an ambulance already intubated, you hit prior.
Okay.
Okay?
Actually intubated, not necessarily keen tube, right?
Right.
Got it.
Yeah. Those are double open. It's not gonna be it either. All right. So once you do that, it'll bring up another box where you have to really fill out the size and all that
Right,
too.
okay.
So that's just the prelim to set up the box, and then you click in the line after that, and then you chart your tube size,
At the teeth.
the teeth, or
Okay.
whatever. Okay. All right. And it'll ask you for the doctor, whoever intubated. You need to put their name there too. So the vent data, double click up there, and see what it looks like. So that gives you the time and date you set up the vent, and then you come down here and you go to charge. So infant or adult, doesn't matter.
Now, in our charting, like we have these key
It's
points
like
that
an
are
AED
blue.
charge.
So for you to
Scan
know that
that.
that's a charge related kind of thing to make sure you chart, but you guys don't have that.
No, we don't have
So
it.
if that gets missed quite a bit, are there gonna be some feedback like, hey, you guys are missing that? Because,
Yes, so what happens is, on the dashboard, I don't know if you guys ever heard about the dashboard. Nursing dashboard, I guess it's mostly for inpatients then.
I just got access to it.
Oh, you
yesterday.
do? Okay, so you can track that. It'll tell you if
I'm gonna get the
who got
charge nurses.
intubated
Or
or
we'll
not.
just get a kickback, like where it has us go back in.
oh, a discern?
Yes.
Yeah.
Oh,
But
okay.
It's not
I'll
even
give you
just,
access to the dashboard. All the charge nurses, I'll give access to the dashboard.
Do you get these?
so the dashboard
And
is
what
a
does
way
that
to
tell
track.
us?
It tracks,
A whole bunch of different things.
yeah, you can track it there to see if the patient was ever extubated properly or charged properly or a lot of things. But then on the charge end, what do you call those people? They review the charts also.
The auditor?
Do you get these?
Yeah.
The
Yes.
So,
this is Sandy.